Hi, and welcome back to the Entangled Health Podcast. I'm your host, Madison Murphy Barney, and today we are going to talk about the importance of listening to complexity and allowing complexity to be complexity. And we're going to explore why simplifying health into silos creates this like non-reality, um, and how like the dangers of designing from that non-reality, and how when we listen to complexity through story and that deep listening process, it brings us back to like what's true, what works, and we can design from there rather than designing from a non-reality, because you can imagine there's a really big impact difference in designing from a lived and listened to and witnessed reality versus like a non-reality that is often like purified and cleansed and put in a silo to the point that it doesn't have a basis in what's actually going on. So I wanted to talk about um when you know when we put health in silos and we try to simplify through models and metrics and these like really neat categories like mental versus physical health or social versus emotional health, it really suspends reality. Or when we look at the folks who we work alongside and who we serve, and we look at like their one health, um say diagnosis or experience, or their involvement with one system of like public service systems and things like that, when we only look at it from that one angle, we miss the true complexity. And when we miss the true complexity, we don't have a sense of the reality of the lived experience of the people who we are responsible for serving. And so, um, one interesting example I wanted to give of this being done really well is at the Geisinger Health System in Pennsylvania. So, the Geisinger Health System created a fresh food pharmacy, and pharmacy is spelled Pharmacy. And so, Geisinger works with patients who have type 2 diabetes, who are food insecure and don't have access to reliable, healthy food. And these patients then receive prescriptions for healthy food. And it's like tailored produce and good sources of protein and other food that is really nourishing that can help manage their symptoms. And so the patients visit the pharmacy every week or 2 weeks to pick up their food boxes, and while they're there, there's other like providers there and educators who provide cooking demonstrations and nutrition, like folks you can ask nutrition questions to. And the results have been really strong. So they've seen like a reduction in um, certain disease markers. They've seen decreased rates of food insecurity from nearly 100% to around 60%, which is a pretty big jump. And there are thus fewer emergency department visits and lower healthcare costs overall. And patients have reported, really appreciating the program and seeing it as a key part of their health and their life. And so, what makes this program so powerful is that Geisinger saw that, writing prescriptions for medications wasn't the only answer, and that people needed to be able to afford healthy food in order to, have access to the health that they desire. And so, and also like to know, to have support in preparing that food and things like that. So they're treating this root cause, not just the symptoms. And there are other hospitals who have developed similar innovations. The Boston Medical Center is one. They have really extensive food pantry and nutrition programs. And there are other hospitals who've started addressing housing instability, transportation barriers, and even legal aid for issues that affect health, like eviction prevention. And so all these examples are really helpful ways of seeing like health does not happen in a silo. Disease does not happen in a silo. Um, our health is inextricably tied to our housing security, our access to education, our access to food, our access to resources. And so I see this sort of honoring of that in a lot of what is happening with some of these programs. And it's really just beautiful to see. And I often see a lot of ignoring of it and trying to maintain the status quo of how work has always been done in health and justice. And it doesn't quite work, right? And so and one of the reasons it doesn't work is when we silo individuals, and silo like individual health, mental health, physical, social, environmental, collective. we end up creating these band-aid programs, and people fall between the systems because if we're looking at someone's mental health but not looking at their social health, it could be that their mental health is like really impacted by a sense of loneliness and a lack of connection. And so if we're not addressing their social as well, then we're not actually really truly addressing their mental health. And um additionally, it's like our collective health, our community's health. So much of our own health is tied into our community health, and it's you know like our health markers are likely going to be similar to those of the people around us. And so often what we see is these funding structures that enforce these like artificial separations and ask for programs to optimize for like a slice while missing the whole. And like, of course, it's impossible to like have every program address the entire whole, but we want to see how our programs fit in with the ecosystem of tending to this like really entangled health, and to not have so many little slices going on without seeing the whole pie. And it's this like fine line of like, of course not every program can address everything, but if we're not looking at what else is available to like tie into our support and to connect to our support, then we're really missing a mark of like only looking at one issue separate from everything else, decontextualized. And like we need that context to fully understand what our communities want and need. And we often see this like a microcosm of this in our organizations as well. We see organizational silos that mirror those same patterns. There's the separate intakes, the separate teams, like duplicated effort, things happening that are very similar and would be really strong in collaboration, but they don't even know that the other is doing it. We see this a lot. And so I think the most challenging part of this reality is understanding that complexity is actually clarifying. So there's this false clarity that we want when we like create these silos and create these really like defined lines of like what belongs where. Whereas true clarity has these models that are story led, and there's listening, and it can feel messy, but it can lead to real precision. Once we do that listening, once we honor what's going on, we can then create like programs and clarity from knowing the true reality. But when we try to ignore that lived reality and to feel clean, it doesn't really work. So it's like is where we invest our time, and when we invest our time in allowing complexity and trying to understand that complexity, we have much more impactful programs as a result of it. And so this type of reframe of honoring that complexity does really ask us to unlearn some dominant narratives of like health being a personal responsibility, mind and body as separate, things like that. Wisdom that we hear of like try to eat better, try harder, things like that. And when we reframe that and see stories as intelligence and not just anecdotes, that complexity it moves from being like the enemy of action and becomes instead like a precondition for effective action. Like we move from learning from the complexity rather than ignoring the complexity and moving from assumption and that like suspended reality. And so this is where our stories become strategy, and there are other episodes that focus just on that. But it moves us from that like listen. We can listen to complexity through these story circles and interviews and witnessing and all these ways of listening to staff and community. That's really key. And then from there, we can design from that reality. We align the programs across silos. Mental health leads into housing, leads into unemployment, and we see this like whole picture. And that complexity really allows us to do much more meaningful, deep work because we're seeing it. We have the whole picture, right? We have the whole sense of what feeds into everything and what creates these challenges that if we're not looking at them, we sometimes overlook as like, oh, that won't be an issue. But when we start something with a sense of what the challenges will be and what the barriers will be, we can design smarter rather than pretending like those challenges and barriers won't affect us in some way. And and then the move part of this, from the listen to the design to the move, is we move hearts and systems, so that once we have designed from that place of complexity and understand it and made sense of the complexity, then we have those narrative shifts where we see policy and funders and donors really understanding the true state of things as opposed to like that suspended reality state. And an example I use a lot is how, important it can be to do like habit stacking on these. So understanding that you don't need a new department to do all of this. You can just really weave story and that listening and that honoring of complexity into your existing operations by just taking a look at your current operations and seeing, where are the opportunities to add this in. And so, um, it's just a matter of looking for those opportunities. And ultimately, as we all know, these inequities follow systemic patterns from past and present. And when communities experience an inequity, all dimensions of health are affected at once. So it's not like inequity in health impacts inequity in education, impacts inequity in housing. And then instead, when we like create and design from a place of moving forward in all of these areas from a place of inequity to a place of equity, we have to be able to see all those dimensions and understand like the ecosystem that we're operating in. And so there are a couple of ways to enact this in your organization. One is mapping your complexity. So you can pick one active program or one thing that's going on and ask like, which dimensions does this actually touch? Mental, physical, social, environmental, and collective. And then and see like what other programs and what other ecosystems it could be plugged into. And then also in that and creating that sort of matrix, understanding where clients or staff hit friction. So is it like duplicate intakes, conflicting eligibility, repeated storytelling, long transit, things like that? And see where that complexity is trying to be seen, where it's trying to come through in those pain points that you and your staff meet all the time. Another step once you have that map is to just really listen differently. Add one story question to your next team meeting or community touch point about what's the part of your experience we keep missing? Where do our forms or processes make life harder? And just like use that opportunity to listen, to just do like small tweaks. And then, so that's like, and then, that type of information will show you like where you can streamline your processes and allow that complexity to take form and to learn from it and design from it and like make small tweaks in what's already happening. And if you're interested in support for this type of work, I would love to have a story lab session with you and your organization. So these are, short focus containers where we surface the lived realities, identify, these cross silo fixes, these different opportunities for your organization, do some deep listening, and then translate all that story and all that listening into strategy for next steps. And this can be like organizational wide. It can be like a program that needs a little bit of support or reimagining. It can be like a great thing to do before you start a new program to see like where we can, what's the state of things, where can we make this make the most sense and make sure that it's plugged in all the places it needs to be plugged in, so it's not just operating in a silo. And it can be like this can be hard, right? Like simplicity is really soothing. Like when we think, okay, there's just like these 1, 2, 3 steps we need to take, or we just need to focus on this facet of health, or all these ways we want to simplify life. Our brains really, really desire that. But just reminding yourself that like if that simplicity isn't true, it won't heal. And like when we listen to complexity, that clarity returns, and it's that grounded, ethical, effective place that we can work from. And so it's like while the simplicity might be soothing in the beginning, knowing that if you listen to complexity, you will have more clarity and simplicity going forward. But we have to start from a place of complexity into simplicity rather than assuming simplicity and then just meeting all of these barriers and roadblocks from like programs that don't resonate, and just so many challenges come up when that's how we're operating. And so it's yeah, it just allow yourself to like go slow with this and to let things unwind over time and to see where you can add in that honoring of complexity day in and day out. And just be deeply, deeply kind to yourself in the process because it's like we are like hardwired to want to understand in simple terms. And we see in the world around us, how much when people feel like, okay, there's a simple, clear answer, they go forth that answer rather than like allowing the real truth to be to emerge and all of the downfalls and pitfalls of that. And so let it be slow, let it be genuine, let it be complex, and also just be really forgiving of yourself and your organization as you like welcome complexity back in after so long of being conditioned to sort of like exile complexity and like look for the simplest answer. Um, and that's not to say it's going to be hard, right? Like complexity and challenge aren't the same thing. Complexity can be a really beautiful thing, and there's ways to like structure it and understanding and like take it. So it doesn't have to be like this like fire hose, it can be this doesn't um this isn't setting yourself up for the most challenging path. It's setting yourself for the most honest path from which you can make the most impact. Okay. Thank you for spending some time with me this week. And if this sparks something, I would love to hear from you. We can connect on LinkedIn. And of course, if your organization is interested in a story lab session, do reach out. And we're booking out a few months in advance. And we'd love to get you on the calendar. And you can reach out at mbarney@entangledhealth.com. And until next time, I wish you all the best and hope that, there's really moments for this complexity and that you are able to witness like the ways in which complexity does serve you. And until then, I will see you soon. Take care.